I became interested in physical therapy after I graduated from high school and was just trying to decide upon a career. And I was interested in science and arts. I guess the criteria I had to meet with myself is it had to be a science, and it had to be something where I was being helpful to somebody else. The majority of what we do revolves around teaching people how to exercise appropriately and develop some self-discipline in a physical rehabilitation program that they must perform in order for their bodies to become stronger and overcome the weaknesses or develop strengths in the compensations they're going to have to make, as well as sometimes accepting behavioral modification that they may have to do to cope with in some cases, pains or limited use of extremities and that sort of thing. You get a chance to share with them in their lives and make things better within their home environment for them. And so Liberty allows for a multi-discipline care system, so that as a physical therapist, I'm limited to physical therapy skills. A patient starts to develop more physiological problems. I will call a nurse. I will call the doctor, ask for orders, for instance, so we're able to call in other disciplines to give us a hand, you know, to meet and the overall needs of a patient. There was an elderly gentleman who was a truck driver, and he had 5-year plan left before retirement, who was being taken out of work because of an injury at work for his back. He had severe degenerative changes that had occurred. The gentleman came to me for about, I believe it was about 4 to 6 weeks, maybe 3 times a week. I did some manual therapy on his joints and to his muscles, basically helping him to loosen up areas that had tightened because he was restricted in motion, regain certain motion, learn certain exercises for strengthening his core and proper body mechanics and some behavioral modification. And his pain levels dropped to the point where the doctor had him work out on his own for about another 6 weeks, and he returned to work driving a truck. It's not really, you know, the payment or the making a living at the physical therapy that's so rewarding. It's actually the gratitude of having helped someone and then them express it even a year or two later out in the middle of the community, passing them in a grocery store, and you know, a family member even saying, "Oh, you were the therapist that came over and helped my grandma."